So right now I'm gonna go through the different costs of Medicare for 2025, and you may be surprised at some of the out-of-pocket expenses there are. Let's first talk about the different pieces of Medicare. We have generally 4 different pieces: Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. Now, in addition to that, we also have Medigap plans or Medicare supplement plans. So we need to put all this stuff together. We need to understand what the costs will be. The first thing to talk about, we'll take it a little bit out of order, is Medicare Part B. Medicare Part B is kind of what everything evolves around. It's the part of Medicare that pays for stuff that goes on outside of the hospital. So not a hospital inpatient admission, but doctor's visits, specialist visits, outpatient surgeries, things like that. But it also is a trigger in Medicare. Generally, when you start Part B, you're starting all of your Medicare. So Part B has a premium to it, and everybody's going to pay this premium. The premium for Part B right now is $185 a month. And this is the base premium. That's another really big surprise, is it is income adjusted. So there is something called Irma, which is income related monthly adjustment amount, meaning the more that you make, the more that you're going to pay. So that $185 is the base amount. And understand this as well, because people don't get this too often, is you're going to pay that Medicare Part B premium whether you choose to stay with original Medicare or whether you choose to go into a Medicare Advantage plan. A lot of people think if they go into a Medicare Advantage plan, they don't have to pay their Medicare Part B premium, but that Part B premium is there regardless whichever avenue that you take. Something else to understand is if you're drawing Social Security, the Medicare Part B premium is going to come out of your Social Security check. If you are not yet drawing Social Security, they're going to send you a bill, and that bill is going to be quarterly. So they're going to want 3 months of your Medicare Part B premium if you are not currently drawing Social Security. So if you qualify from an income standpoint to pay more for your Medicare Part B, and under this can go up, and it goes up incrementally, but it can be as much as about $600 a month instead of the $185. So I have videos on that. Just search through my channel. I'll have a couple listed below this video in the description where you can understand the Irma part. And it's something that happens year by year. So you might make more income one year than another year, and it's going to affect that Medicare Part B premium. So we want to understand that Irma for sure. But right now we're going to talk about the base rate of $185 on your Medicare Part B. Now Medicare Part B also has some out-of-pocket expenses. When you go to the doctor, when you go to the specialist, outpatient surgery, whatever it may be. Number one, it has a deductible. Right now that deductible is $257. Now the good thing is it's an annual deductible, so you only pay it once a year, and then you're done with the deductible part, and then it goes to 80/20. So Part B functions kind of like old insurance used to, where you have a $257 deductible, and then Medicare is going to pay 80%, you're going to pay 20%. Now typically this is where you would have a Medicare supplement plan or a Medigap plan that's going to cover that 20%. It does not cover the deductible, so you're always going to be responsible for that $257 deductible each year. Again, not too big of a deductible, so we can manage that. But that 20% can get out of hand. If we have a significant medical expense, the 20% under Part B does not have a stop. So generally, we're going to want a Medicare supplement plan, either Plan G or Plan N, that's going to cover most of our out-of-pocket costs with relation to Medicare Part B. And I have certainly videos on different Medicare supplement plans, also the link below in the video. Take a look, and we make sure that we get the right one at the right price, just to keep things simple and easy going forward. So that gives you a pretty clear understanding of Medicare Part B. Now Medicare Part A is stuff that happens during an inpatient hospital admission. It's going to pay all your room charges and things that relate to that inpatient hospital admission. Generally a big bill comes out of a hospital when you're admitted. Now Part A also has a deductible. It's a much larger deductible. It's $1,676 under Medicare Part A when you're admitted into the hospital. Now that deductible is not annual. It's on a per occurrence situation where if you have something happen multiple times during the year, you could pay that deductible multiple times during the year. So again, you would generally want a Medicare supplement plan that's almost always going to cover all of that deductible anytime that you go into the hospital during the year. So with you have original Medicare with A and B, you're generally going to want a supplement that's going to cover that 20% out of pocket on B. It's going to cover the deductible on Part A. The other choice is going into a Medicare Advantage plan. And if you've seen my videos, you know I do not recommend Medicare Advantage. I do anything I can to stay on original Medicare. Original Medicare, even though it has those out-of-pocket costs, a supplement covers them, and it gives you the freedom, the flexibility. You can choose any doctor, any hospital, anywhere in the country. It just gives you all the control. With a Medicare Advantage plan, it puts you into the custody of a private insurance carrier, where you then have networks of doctors, hospitals. You also have referrals. You also have pre-authorizations, things like that. Make sure you watch my video on why I would never choose a Medicare Advantage. I think it's got about 2 million views right now. It's certainly something you need to understand before you make that choice. So that gives you a pretty clear picture on Medicare Part A and Medicare Part B. And again, Medicare Part C is going into a Medicare Advantage plan. So you need to understand that completely. And the problem with Medicare Advantage plans is they're all completely different. So it's very difficult to compare what might be better for you. And a lot of times people just get sold into a plan that's better for the person selling them than it is for you that needs whatever type of healthcare you may need. Now, you'll certainly find some comments in this video below on people that love their Medicare Advantage plan. I generally find that people that don't use them a lot tend to love them because the out-of-pocket expense is low going in, but when you do use them, the restrictions that are involved and the out-of-pocket expenses there are much higher when you use them. So it's certainly something to understand. I'd be happy to walk through this with anybody. Visit my website, MedicareOnVideo.com. You just fill out the form on my website, give us a call. We will make sure that we just get all your pieces put in the right places. Now, last on that list is Medicare Drug Plan, Medicare Part D. If you're gonna stay with original Medicare, A and B, with a supplement, you may or may not get a Medicare Drug Plan. It's a little different these days because there are a lot of options that are available, from GoodRx to even just regular Walgreens has their own membership plan where discount drugs work much better that way. A Medicare drug plan is great typically, I find, if you have complicated medications. If you certainly have cancer medications or things like that, very expensive stuff, it can certainly limit that out-of-pocket expense. If you're just taking little to no medications or just generic medications, blood pressure pills, things like that, you may do just fine without one. But I have a complete video on how to get a Medicare drug plan because it's best to do it on your own. It's very easy to do. They have a great site that allows you to figure it out. It's based on medications that you currently take, but better than having somebody sell you one. Again, it might be better for the person selling it to you than it would be for you. So that gives you kind of an overview of costs on Medicare. Again, if we back it up a little bit to original Medicare A, B with a supplement, even a drug plan, your complete out-of-pocket cost is generally going to be less than $300 a month for truly fantastic coverage. Very little out-of-pocket expense as you use it, with freedom and flexibility to do whatever you want. If you go into a Medicare Advantage plan, you might get it closer, in the $200 range, but the restrictions, the limitations, the controls that the insurance carrier has, to me, it's just worth all the difference in the world to stick with original Medicare and have a supplement going forward. And that's what we do. We help with that Medicare supplement plan. It's how I make my living. There's no cost to you to allow us to help you. The insurance carrier that we use with that supplement plan pays me a little to be your service agent now and in the future. So I hope you'll allow me to help you. Make sure you take advantage of all the information I have. I have a free book you can download. I have a Medicare mini course that breaks this up into bite-sized pieces. And again, just video after video on everything Medicare. So happy to help with any of it. Hope you have a fantastic day.